Here in GAOC, we work as a team. We have different doctors who specialize in different fields. So we always make sure that we try to consider other input in the treatment of the patient.
Being a dentist, it's really demanding of your life in general. But you have to make time for other things, to do something else like sports or other leisure.
Yes, it is my childhood dream to become a dentist. Before, my aunt used to do my braces. So, naengganyo akong mag-dentist. Nakikita lang sa mga ginagawa nila sa loob ng clinic. So, she lets me be a dental assistant. Minsan, gano'n.
Rewarding. Very rewarding. Rewarding not in the sense of something tangible. More on, it's different when you treat your patients and you see that they're comforted or happier with their smile.
Every day, we encounter different patients. They also have like different personalities.
I believe the most memorable was when I had a patient from London and she was very afraid about dental treatment, even had a traumatizing experience. She just came back for wisdom teeth removal just because she's more at ease with my care and with my skills. And I believe that's the most memorable because I was really touched with the trust of the patient.
Communicate with our patients via email, calls, text, and of course, in order for us to do that, we have to be updated with their current treatment. So it's very important to us to have the most accessible kind of patient record system. And that's how important Medix is, because of course, if you're lost with the treatment of the patient, you can be talking to them differently.
We are used to doing charts and then writing everything down. Now it's all online. Definitely it's easier.
Before the day ends, we need to compile or we need to get all the charts of the patient that was scheduled for tomorrow. And then now with the Medix, just one click with the computer, there you go. There's the chart of the patient. We can access everything, even in the other branch.
Easier because now, whenever there are emergency patients, especially, I can keep track of their previous procedure, and of course, I can help them more. We get a lot of calls late in the evening saying that, for example, they're having an allergic reaction or they're worried about this particular reaction of their body. With just a slight scroll of the screen, you can see which procedure, which medication was given, and you'll be able to help them quickly.
So having a physical chart is such a burden. You have to scan the page, the chart, the written chart, in order for the other branch to see the current treatment.
So in Medix, we just scan it to the computer and attach it to the Medix. If hahanapin namin, we just click it, then andyan na.
Well, of course, there were bumps in the road, but as a team, when we all got used to it, we figured out it was faster and actually more efficient. There were less errors in computation for billings. One, there were, of course, easier endorsements.
It helped us to do our job easier and lighter. Kasi nare-record na namin doon lahat, nai-input na. We don't need the papers, yung sulat pa namin. And kung nawala yun, wala na rin kaming record. Tapos sa Medix, not only one dentist can access, all of us can access, even the front desk can access.
Doctors' handwritings aren't the best, and you can't get the right endorsements based on that. With Medix, you can see it's all typewritten and it's all uniform. So there's less miscommunication between each dentist.
I personally like the gallery part. I make sure that I see x-rays of the patient, so that's very helpful.
Basing it on our experience, like for example, there is a walk-in patient that we haven't encountered because we have different branches, right? So we just search the name, and then right there and then we can read the files, know the history of the patient and what treatment was done.
To be honest, I can go home earlier. I can spend more time with my family, and during that moments, I can still monitor our patients.
All the treatments are well organized in Medix. So they see that you are more efficient, and they see also that if you're efficient in keeping your records, you do a better job also at your work.
I believe this system is really good. It can help uniform your charting. It can help make things quicker.
I am very privileged to be able to use the Medix